This is the Barbell Therapy and Performance Podcast, where traditional healthcare is redefined to help listeners achieve peak performance, accelerate recovery, and elevate overall health. Hosted by Dr. Bret Scott, a doctor of physical therapy and national strength coach, this podcast explores the worlds of fitness, alternative medicine, and holistic health. Each episode uncovers innovative strategies and practical solutions for those seeking to enhance their quality of life when conventional methods fall short. It is our firm belief that every living thing has potential, and it is our mission to help you find that potential.
All right, everybody, welcome back to the Barbell Therapy Podcast. I'm your host, Dr. Bret Scott. Today, we're going to be talking all about baseball and strength and conditioning for baseball with my friend, Greg Robbins. Greg's got a military background. He's been a collegiate baseball player. He's also been a competitive powerlifter. He was a strength coach for Eric Cressy at their gym for many years and is now owner of the Strength House. He's coached many D1 level baseball players as well as multiple pro MLB players as well. Me and Greg go back about 10 years now, actually, going out for ice cream on double dates. But we haven't gotten to talk too much shop about training and things that happen. So for us as coaches and PTs, we see a lot of baseball athletes for training and for rehab. And I think Greg is a great resource. And so we wanted to sit down and talk with him today about the ins and outs of competitive baseball and how to train for it in the weight room and how we can better prevent injuries within the sport and everything there. So Greg, thanks for taking the time out of your day to come on here. And he warned us we might get a 4-year-old appearance from his daughter there. So if she comes on, that is totally fine with us. But yeah, again, thanks for coming on. And anything else there for your intro? Anything you wanted to add?
No, I think you covered it. Yeah. No, I'm just thanks for having me. I appreciate getting time on the podcast to come on here. So look forward to talking about baseball or wherever we end up. Yeah.
Yeah. So one of the biggest things I've seen now, and it's not just baseball, it's kind of all sports with the youth athletes, but it's becoming more and more of this year-round thing where kids are doing fall ball, spring, winter, specialty camps, working with one-on-one coaches for batting, pitching, catching, whatever. Do you think there's any problem with where the sport is going in that sense?
Yeah, I think there can be. Yes. I'm not a huge proponent of early specialization in the sense of it kind of depends on how old they are. So if we're looking at, below 16 years old, I'm hoping that they're playing multiple sports. The level of which they're playing those sports at doesn't really matter so much, but getting that exposure to a winter sport like basketball or hockey and a fall sport like football or soccer, I think the proof's in the pudding. When you look at some of the best athletes, even, in Major League Baseball, a lot of those guys were 3-sport athletes growing up. That being said, like every athlete's a little bit different. So you look at a Major League Baseball player, 3-sport athlete in high school, he's also just a freak generally anyways, right? So he might not have been a guy that needed as much time on the training and development side where the sport was giving him a lot more. Where you might have some kids that are not as gifted as athletes genetically, and playing 2 sports and having a winter where they're doing a little bit more focus on training or something like that goes a long way for them. So it could definitely be very individual to each kid. But having been in it for so long, probably my biggest gripe, the one that concerns me the most, would probably be like the showcases that happen in late September, October, especially for pitchers. So I think it's also a big difference if we're talking about position players versus pitchers. Position players aren't going to be throwing nearly as much at nearly the intensity of starting pitchers. And so it's kind of like they go through that spring season, whether that be high school. Generally, we'll just kind of take that age group. They play high school baseball. Then they're going to play summer baseball because that's become probably like the more important one for them in terms of exposure for college recruiting. And if they're good, they're out there, they throw in a lot of innings. And then I think where I get worried sometimes is the summer baseball kind of schedule ends maybe late August, and then you have this sort of month and a half where they're just kind of chilling, or not maybe not taking care of themselves or keeping the arm where it needs to be, and then they go out and generally that showcase that's happening late September, October. I'm not gonna like name names of the people that are putting these showcases on, but they're kind of big, air quotes if you're not watching the video, like big name showcases. So kids go out there and they want to like throw the ball as hard as they can, and that one worries me a little bit. Um, but you know, I think if baseball's their thing and it's a very skill dependent game, I don't necessarily see a problem with working with hitting coaches, working with pitching coaches. It it's like anything. It's like it depends who you're working with, I guess, and if they're smart about managing the volumes, and how many swings they're taking, how much they're pitching. There's ways to work on your game without pushing the intensity so high that you're just racking up too much volume. So I think it can be done, but I wouldn't advocate against playing multiple sports either.
Mm. And yeah, especially pitchers is the big one there. They're just there's a lot more volume there that they're taking on. Is there a period of time though? So you're worried about them taking a short period of time off and then going out and trying to kill it. But is there a certain period of time, especially pitchers should be taking off from throwing through the year to just kind of recover and um, get away from it and do something else to develop in other ways?
Um, yes and no. I think I'm not a huge fan of long shutdowns in pitching. Like that was very popular for a while, and in some camps that's still popular. Like doing up to like 8 weeks of shutdown. But I've personally, when I give out advice to pitchers, like I've moved away from that. So even my pro pitchers, if they're healthy, they're gonna take after that season maybe 2-3 weeks off of throwing. But then they're gonna start throwing again. But like throwing is this very general term, right? Like, are you throwing max intent bullpens twice a week? No. Are you throwing a ball? Yeah, we keep throwing a ball. Like, um, I, I've seen more trouble with the long shutdown because the long shutdown is going to require a longer ramp up back to that intensity. And if that's not done correctly, then I think you open yourself up to more injury than if you just continue to throw, throughout the whole year. But just like anything else where you're managing volumes intensities, like if it's a weightlifting and you're a competitive Olympic weightlifter or power lifter, like you go through periods where you don't necessarily train with the same intensity or the same specificity, um, but you don't stop training completely. Once in a while you do. You take a week off here and there, but you don't stop altogether. And so that's kind of what I advocate for is something like that.
Okay. It probably just means too, like bringing the frequency of throwing down or pitching down. Um, and so, um, is there a certain age too, kind of going back, is there a certain age that parents or kids should look at when an athlete should decide to specifically like specialize in baseball? Is
Um,
it after high school or in high school?
for me, it's like it's when they start. So most of the athletes, almost all of them that I deal with, they want to play college baseball. Like that's the first goal, right? And they might want to play professional baseball too, but first they gotta, the original thing, you want to check the box, play the highest level college baseball that it can. Um, and if that's the goal, then at some point you got to make the choice to specialize in that, because you want to push yourself to get as good as you can to reach that level, and that's going to take specific work to get that done. It's going to take more swings, more time working on your mechanics if you're a pitcher. The training side of things, that can be going on all the time, regardless of what you're doing. Obviously, you open up a little bit more time for training if you're not in a competitive sports season, regardless of the sport. But that's sort of the first thing I look at, because sometimes I'll have kids that are pretty good, let's say at two sports, maybe even three sports. And so they're playing a high level of club baseball, but they're also having this opportunity to play a high level, let's say, of um, like club hockey. And that's one I run into sometimes. And it's like, the higher level that you commit yourself to in that club hockey, well, with that, just like when you commit yourself to a higher level of club baseball, means they're going to demand more from you. There's going to be more practices. There's going to be more expected of you. And so that's when I have to be like, well, listen, what do you want to play, college hockey or do you want to play college baseball? And if the answer is college baseball, and we're talking about like a winter sport like hockey, well, it's like, well, that hockey season's going to transition right into the baseball season. Maybe I'll get a couple weeks off in between, but you're going to be missing out on some development that you could have been doing for the sport that's ultimately more important. Because at this point, it's very rare that a kid's going D1 to play multiple sports. It happens here and there, but I can't think of the last kid I've known that went to play D1 multiple sports. So if they are going to be a multiple sport athlete in college, which is super rare to begin with anyways, now we're talking like probably a D3 level, which is, a little bit different. The aspirations of playing after college, if that's what you're doing, aren't as high. So it's just having like a real talk with them, like what's more important to you? Like, you want to play D1 baseball and set yourself up to possibly take a stab at professional baseball? You want to play multiple sports in college at the D3 level because you love playing sports and that's what you want to do, and then after that, it's on to the real world. Then do that. But so that's kind of the differentiating factor for me. But again, if we're talking like the younger groups, pre-high school, like keep playing the sports that you like. I think ultimately too, it's like, as a parent now, kind of thinking of that. Not that my kids are far away from playing sport, like competitive sports, but you want them to try a bunch of different stuff, and then you end up usually you don't necessarily. Well, I guess you end up doing the sport you like, but you end up liking that sport because you're good at it. Like, and you end up good at that sport because you're generally built for that sport. Like, I was never going to be a basketball player.
Same.
Like, it's just never going to get me on a college basketball court. You were never probably going to get me on a high school basketball court. But I played like rec basketball, and I think that was positive because it made me run, which I didn't like to do. So, if they're playing rec basketball, I'm like, cool. Unless there's some reason that rec basketball is a bad choice, like you got a bunch of, you know, tendinosis in your knees or something like that, and you play basketball, and like we can't train because every time you go out and play rec basketball on Friday night, you can't move for 4 days. But so it's like maybe they're specializing early, or maybe they're just gravitating towards like what they're gonna actually be good at. And
Yeah.
if you're actually good at it, then just do what you're good at. Like, mom told you could be anything you wanted, but that's not true. So you're
Yeah.
gonna be like what you're built for, so to speak.
Yeah. A lot of times I see the sport chooses the person, A, because they're good at, and they like it because they're good at, just like you said. And then there are those other factors too of how tall we are and how fast we are and whatever our given genetic potential is. But on to more strength and conditioning side, uh, I think everyone knows at this point, like arm care is important and things, but I think some people have this idea that, strength and conditioning for baseball is a couple banded rotator cuff exercises and, a couple runs here and there, and that's about it. So what are the big things as someone that specializes in baseball? What are the major misconceptions you see that people have about it? And, what should things look like versus what people think they look like?
Yeah, I mean that's a big question that could go down a lot of roads. So I'll try to tackle it, and you can redirect me if you want to. But if we start from the arm care side of things, you know, like you said, you say arm care, and if you've been exposed to baseball at all, the first thing that pops into your head is like external internal rotation tubing exercises, or like I's, Y's, T's. And, my stance on that has gone back and forth over the years. But
Same.
the way I look at it now, like the first thing I would tell people is that those are exercises, just like everything else that you could possibly do is an exercise. So like a split squat is an exercise, a squat is an exercise, a bench press is an exercise, and arm to your side, abducted at 30 degrees, external rotation with a band is an exercise. And so, like as a strength coach or someone that's prescribing that stuff, even therapist, you have to ask yourself, like, am I approaching that the same way that I would when I would prescribe any other exercise? Like, this person comes in and do some sort of screen and decide whether they're able to squat, and you're like, okay, no, I don't think they're able to squat yet. Um, so like, what is your kind of proxy test to decide whether that ER exercise is the right one, right? Or are you just going to default into saying, oh, you're having shoulder pain while your cuff is weak? Um, you have to have a stronger rotator cuff or a stronger arm. And it's like, could we be any more general? Like, what does that mean? You know? So I look at those isolated exercises. You could compare them to isolated exercises that are more traditionally used in a gym, like bicep curls or tricep extensions or something like that. It's like none of those exercises, bicep curls, tricep extensions, quad extensions, like they're not good exercises in the sense that they don't really follow the principles of what's actually going to happen when you have to put force into the ground, let's say, and then transfer force through the entire system to propel yourself forward, whether that's throwing a baseball, running, swinging. Doesn't mean that they don't have a time and a place, but you know, generally, if you are a strength athlete, you might use tricep extensions to get bigger triceps because you want to increase the surface area of that muscle so that it can then be used in your sport. Um, so we have to ask ourselves with all the arm care exercises, the way I look at it is the utility in those first and foremost would be, can I produce a movement that it is getting a relative motion between the humerus, so the arm, the big arm bone at the top, and the scapula. Like those two things shouldn't be locked together where like I'm just jamming a scap back into retraction while I pull my arm out into external rotation, because that's not going to get you the return on that exercise that you want. So I would have to screen that and say, well, does this person have relative motion at the shoulder? Can they get a humerus to rotate a certain amount before it runs into a scapula and then takes a scapula with it? Or vice versa, if it's something that's more on the scapular end of things, like a Y or something like that, like a Y exercise. Can I get the scap to move without just cranking the arm around with it? If I can check that box, okay, then I can start to introduce something like a band or a small amount of weight which all I'm doing, like you would do with any other exercise, is just testing. Like you're just seeing, does that strategy hold up against a little bit more load, a little bit more intensity. But like it doesn't take a scientist to look at the throwing a baseball and say how much velocity, how much force is going on in that movement versus taking a 3 pound dumbbell and rotating it out to the side. Uh, they're not even close, like, not even nearly close. So, um, you know, it's is it necessary for everyone? I don't think so necessarily. Do I want them to have the ability to demonstrate that movement, like I said, and show relative movement? Yeah, I'd like them to have that ability. Um, but it doesn't necessarily mean I'm going to spend a ton of time making sure that we push a ton of volume on something like that, or
Yeah.
move it from a 2 pound dumbbell to a 5 pound dumbbell. That's what drives me crazy. Is like they need a stronger shoulder. Okay, so you're gonna do exercises with a 3 pound dumbbell, and you're gonna tell me that that's the strength you're looking for. And then the return that's the argument you'll get back sometime is like, well, you'll go to sort of like a manual muscle testing side of things and be like, okay, well their shoulder hurts, and we manually tested the strength and external rotation on the right arm, their throwing arm, and it was this number. And we did it on the left arm, and it was this number that's higher. And therefore, it's showing a weakness, side to side. And
Or
then,
they're
like,
just in pain.
right, well, yeah, the pain, well, first of all, like, can they do the test pain free? No? Okay, probably not a good test. Let's say they can do the test pain free and it's weaker. Okay. Are you telling me that your test that you set up completely controls for the exact same position of the rib cage, the scapula, the arm on both sides? Like, are we
Oh,
really doing the same thing? Probably
no.
not. So let's just make sure that what we're looking at is not a positional problem that is, putting muscles in at different orientations and then decreasing force output because of that in that specific position versus everything's exactly the same and that side's definitely weaker than the other side.
Yeah, I want to highlight that real quick here and summarize it a little bit. I think we're thinking the same thing of, yeah, if you go to a PT and they're doing, and you're a high level athlete, whether it's barbells, baseball, hockey, whatever, and they're basing your treatment off of a muscle test that's isolated to one muscle or movement and not really a pattern, it's not the best because our body moves in context specific ways. And so, like, I think the big thing, even with these, the importance of doing those little banded exercises is the way they're executed, which can like make or break them too. Of, can you hold your scapula in one place and just rotate the humerus, or vice versa? Can you just move your scapula without getting too much from the humerus? And so do you have this thing we call joint interdependence where you can independently move a joint through its full range? And yeah, like the tough part about baseball to test these things clinically is like, I don't really ever use strength as a metric there. And people, my company's Barbell Therapy, but we don't actually do a whole lot of strengthening with people. It's a lot of repatterning things and looking at things from a different lens of like, like with weightlifters a lot, it's like we see ankles causing shoulder issues all the time because they can't flex or move from that different part. So it's like, what parts are going on there? What things aren't making sense? And is your rehab really being like context specific to you? And yeah, like your arm by your side is a very different motion than your arm up overhead, and what strength you may or may not demonstrate there. So I just wanted to kind of highlight what you were saying there.
Yeah, and you made another like good point, not to go down another rabbit hole, but like to do it succinctly, it's like if you're going to somebody with a shoulder problem and you're a baseball player and the only thing that they're testing range of motion wise is your right and your left shoulder, they're I
That's
get worried
another,
about that right off the bat because it's like the body it works in iterations. It's a fractal representation of itself. So like if you look at a pelvis picture of a pelvis and you look at those two bones on the side, the iliums, it doesn't, you don't have to have a huge background on this to look at the shape of those bones. Now go look at a shape of two scapulas. Okay. If you flip a scapula upside down and put it next to an ilium, it looks like the exact same bone because it is. It's just you don't walk on your hands. If you did, it would be the same thing because you'd be upside down the other way. So like even the tests that you're doing on the table they're all dirty. Are they useful? Yeah, if you know what to look for, they're useful. If you know how people like what could happen if something's in a different position and how that could change the measurement, it's useful. If you don't know that, you're just gonna get fooled. You're gonna look at a shoulder, um, which arm is a lot lighter than a hip, for example, than a leg, for example. And depending how they're taking those measurements, like you'd be like, well, this person has internal rotation of their shoulder in the right shoulder. Did you check the hip? The hip doesn't have any internal rotation. The hip doesn't have any internal rotation. I'm going to guarantee you that the shoulder doesn't actually have any internal rotation either.
Really?
You just, yeah.
Okay.
Because, or it could go the other way around. You could look at a shoulder that isn't giving you the internal rotation. And you go to the leg, and because the leg's heavier, like as you go to turn it, you're turning you're getting the pelvis to turn on the table, and you can't see it. But that's giving you a false measurement. So like you have to have a lot of different screens to really understand what's going on with that person, and then you gotta look at it big picture and say, okay, like what I have here is let's say an entire right side is just oriented out into external rotation. And I put them on the table, and because of the way they lay on the table and kind of where they rolled, or maybe because they still have motion at the neck or something like that, I go to move the arm and I get the internal rotation. But you don't know that came from the shoulder unless you're checking other stuff to say like, okay, but it's not at the hip. That's interesting because it should be at the hip if it was at the shoulder. Okay, well maybe I got a lumbar spine that isn't really moving anymore, but I got a cervical spine that is. So I go to test the IR on the shoulder, and the cervical spine starts to rotate a little bit away from me, and that exaggerates the IR number at the shoulder. And so then you start making a bunch of presumptions that just aren't correct. And so, like, but then again, it's like, maybe like you have to factor in that like this pain is from throwing. So yeah, it's like you said, the execution of those exercises is everything. So like you deal with a lot of lifters. I used to deal with a lot of lifters. If a lifter came to me with back pain in the deadlift, what's the first thing I'm gonna do? Show me how you deadlift. Like, why wouldn't I start there? Because what if you're just doing like
Stupid.
really stupid deadlift, right?
Yeah.
Oh, your back hurts when you deadlift. Okay. Well, I could see why that happens. Your arm hurts when you throw. Let me see a video of you throwing first. Okay, like I'm not gonna just like decide it's just from throwing, and obviously maybe it was, but now we have another issue because of the throwing. Um, but I still want to see that because like I need to understand the whole picture here of what's going on. Um, and it's like, okay, well, you don't have the hip motion to acquire the right position when the foot lands on the ground, and then the energy wave that should be propagating up to the arm is not propagating up to the arm. It's hitting you somewhere else. And so now you have a flawed pattern with the throw, and now you have shoulder pain. Okay. Well, yeah, maybe we do have to do some stuff to get some space back at the shoulder, but ultimately, if that's all I do, it's going to come back. Like I see that over and over and over again. Like
Yep.
guys go in, got a shoulder problem. It's a weak rotator cuff. Okay, we're going to strengthen that thing up and, do a bazillion strength exercises. And, certainly sometimes they get back on the field and they feel fine. But then it's like the end of the season and we're right back where we started. Well, dude, you didn't address the right thing. So that's, it's complex. It's not complicated. Like, a lot of variables are going in there. The truth is we don't know, to be honest. Like, especially if we're dealing with an injury, like, we don't know.
No.
What we need is a model for movement that is the closest to the truth that we can get, so that we make better guesses, and then we make the best possible guess that we can, and then we go to work. Like, that quote, like, jump in the net will appear. Okay, well, I'm gonna make my best guess. I'm gonna start going to work on this, and then as I do, more stuff's gonna pop up. I'm gonna start seeing more stuff, and the picture's gonna get clearer and clearer. Like, I started with a thumbnail. I'm gonna click on it, picture's bigger. Click on it, picture's bigger. It's like, now we're getting back into throwing, and it's like, and so, you're never 100% right when you first decide
No.
where to go.
Yeah, it's an educated guess on a piling pieces of evidence that you have to make a case for, but you can't ever prove it's this or that or the other for sure. What is this whole phenomenon though with like the shoulder and hip IR being like you either have both or you don't? I've never heard this before.
Um, okay, so I got to credit this to my mentor and kind of the guy that has taught me so much, is Bill Hartman, who's a physical therapist
So
in Indiana.
is this some PRI stuff?
I know I would not call it PRI. It's not like a PRI is. I don't want to speak out of context because I don't do PRI.
Okay.
But my perception, I have. I mean, there's some binders up there behind me somewhere. Years and years ago, I did do 2 or 3 PRI courses, which, at first was, did I learn some stuff? Absolutely. Like, those courses were useful. They were probably, some of my first looks into, like, just understanding biomechanics better. And from what I remember, so, like, hopefully I don't want to piss anybody off that's, like, deep into that. Um, like, I did take a lot away from it. I'm only going to speak on my personal experience with it, which was that, and this could have changed because, like I said, that was 8, 9 years ago. It was a system to me, and systems fail eventually. Like, they can't work for everybody, so it was kind of algorithmic in the sense of, like, oh, you see this presentation, do this. Now you do this. Like,
So what was Bill
I think
saying?
there's like,
What what what
um,
did Bill teach
so
you?
not so Bill is has created a model. So I think models are more useful than systems because a model is just, like I said, a representation of, like, what we think is going on, is as truthfully as possible, and, like, the model has to be built on principles, and then, like, first principles. So, sciences, things like the biomechanics of stuff, physics, um, and looking at the model, like I said, we would see a fractal representation between different iterations in the body. So the hip, the lower extremity, and the upper extremity are not that different. Um, and the biggest difference is that we walk on our feet. We do things with our feet, not so much with our hands. But when we are talking about baseball players, we are creating a force against an object. Um, and so if we look at that and say, okay, well, if we relate it all back to, let's go with, like, propulsion. So if we look at propulsion, which would just be like moving forward against the medium, so that could be walking, that could be running, that could be crawling, that could be throwing, that could be swinging. It's going to go through 3 phases all the time. All of those movements are going to go through 3 phases. So uh, it's going to go through a early phase of propulsion, a middle phase of propulsion, and a late phase of propulsion. So we'll use walking as the example. When I walk, when I take a step forward, let's say with my right foot, as my right foot is about to, let's say it hasn't hit the ground yet. Well, if it hasn't hit the ground yet, then there's no force necessarily going through the system on that side at that point. So everything is an externally rotated representation. Um, so, depending on kind of your model, you might look at external rotation with a lot of different verbiage. But to me, it's any movement away from midline is an external rotation. So we know external rotation as like the traditional like external rotation shoulder, but so is flexion, so is abduction. Those are all external rotations. So you got an ilium that's externally rotated. You got a femur that is technically um, it's relatively internally rotated relative to the position of the ilium. Then you have a tibia that would be externally rotated relative to the femur. And then as the foot hits the ground, we are in an energy absorbing position. So that is where we are going to start to layer internal rotation on this externally rotated representation. So it starts at the foot. You would need a foot that can turn over into traditional like true pronation. Then you would have a tibia that could internally rotate. That wave would make its way up to the pelvis, where the ilium would internally rotate, and there would be a moment in time in the middle where internal rotation and external rotation layer right over each other. But if we go up the extremity, the exact same thing is happening up the extremity too. The rib cage was in external rotation, the scapula was in an externally rotated position, and as that foot hit the ground, we would need a rib cage that could internally rotate. We would need a scap that would go into internal rotation. And then as we come out of middle and we start to propel off of the ground, we're in an energy producing position now, but the shape is going to ideally return right back to that externally rotated representation, because the internal rotation is coming now. It came distal to proximal. Now it's going proximal to distal. And as the foot eventually leaves the ground, there is no internal rotation represented anymore. And you're right back to where you started to set up the foot landing in front of you again. So from a shape standpoint, the early and the late are the same, which would mean that the joint positions are the same, which would mean that the muscle activity is the same. The only difference would be the connective tissue behavior. It was in a more yielding or energy absorbing behavior when you hit the ground, and as you started to propel off the ground, the connective tissue stiffened up and became more of an energy or overcoming and producing energy behavior.
Can you draw this on a whiteboard for me?
If I had one,
I'm kidding.
but like iteratively, if I start to lose internal rotation, let's say, so again, we could go deep down in this based on the archetypes, which Bill has so cohesively put together in this model. And I think, some people are familiar with this narrow versus wide concept. We don't have to go down that road necessarily, but let's just say that if I get a pelvis that anteriorly orients, or more people talk about that as like an anterior tilt. I'm going to call it anterior orientation. Well, if that anteriorly orients, right, it's going to obviously affect everything up top too, right? So the rib cage is also going to anteriorly orient, okay? And the scapula is going to follow the rib cage. So that is going to anteriorly orient. So it's all an iteration. So like I know that
Okay.
if I have an anteriorly oriented pelvis, and you lay on my table for measurements, and that pelvis is in the anteriorly oriented position, well, the the muscles involved there have now their line of pull has changed. So your external rotators are now actually in a position of internal rotation. So you might lay on the table and show me really big internal rotation numbers and really small external rotation numbers. And I could get fooled and be like, okay, you have great internal rotation. It's external rotation you lack. We don't really have internal rotation, because internal rotation can only live in an external rotation space. You would have had to have that first. Like if we look at internal rotation as this force, like compression, like it has to exist on top of external rotation. So if I lose the external rotation, sure, I can, on a measurement, look like I have it, but I don't, because if I didn't have external rotation, I can't have internal rotation. So if I go up to the shoulder and now I'm seeing internal rotation and external rotation, that's a clue to me that, like, okay, this is not real internal rotation that I'm dealing with. It might not even be real external rotation. We lose internal rotation as our center of gravity gets pushed forward further in space. So when we start carrying our weight on the front of our feet more and more and more, which is going to be a lot of athletes, you're going to lose internal rotation. Because if we think about it, like, how did we move forward in space? Well, we would have to have a pelvis that got pushed forward from the back. So we would have had to have muscle activity on the back or compression on the back, just like I came up behind you and just like pushed both your butt cheeks forward, right? And so I'm pushing the pelvis through the femurs, essentially. And to do that, that means that the femurs are going to orient themselves out into external rotation. Like, how many athletes have we walk in and they're, duck-footed with toes pointing out in both directions, and they have, in this case, maybe no internal rotation when you test them, but it looks like a lot of external rotation. That's not really external rotation. They just have like hip sockets that are just facing out to that direction. So you measure them and it looks big. But like their available space to move into is no longer in front of them. It's out to the side of them now. The same is going to be true at the shoulders. And so like you kind of have to look at that iteratively. And sometimes, like I said, the measurements will be dirty and they'll fool you. And that's why it's like, I need to compare the right shoulder to the right hip. I need to look at the right foot. I need to look at everything. Like, because if I gotta, like, we see a lot of people with like bowed out legs, right? Looks like you could toss a beach ball between their knees. Well, those are bones that are like bending, right? Like there's no relative motion left there. They're producing force now by just bending bones. Like that's how they're getting some motion. Okay, so that means I got a tibia, like a proximal tibia, that is just completely externally rotated. All right, so I'm not going to be able to get internal rotation. Well, go check out the arm and the thrower that has that going on, right? Like, what are you going to see? You can see a proximal radius that's generally very externally rotated out relative to the humerus. So, like, I'm not saying always without fail, but a lot of times you start to look at those iterations and they help you out quite a bit.
Good to know. I'll definitely be taking that into my clinical considerations. And then what things are most athletes that are baseball players missing out on in their programming for baseball strength and conditioning?
And well, I'm not gonna give you the "it depends" answer because no one wants to hear that. But let's use like
there's a couple different things. I think it's like what I see of like what parents almost expect. It's like my kid's got to come to the gym and they need to do their band exercises every time, and they need to do some like lateral med ball tosses and some box jumps, and it's like all right, like we're in the dead of winter, like we're gonna have them deadlift heavy. It's like, well, why? That's not baseball. Isn't a strength sport. It's like, yeah, no, but like they need to produce force,
yeah.
and they also need to be like strong and resilient too. So, yeah, what are your thoughts there on?
Yeah, we can go down like that road more specifically, like how strong is strong enough, kind of, right? Like that
Yeah,
question gets asked a lot, and like I that's one reason I like baseball. Like I really like training baseball because I really like solving problems, and like there's no shortage of problems when it comes to baseball because it's just it's such a crazy, especially if we're talking about pitchers, like it's such a crazy movement, right? Um, like we're talking like about relative motion or joint interdependence, like that is not going on at a very high degree when you actually throw a baseball. Let's be clear on that. It's too high of a force. It's too high of velocity. Um, so essentially, we have to look at like this is the easy answer. How much testing and retesting are you doing, and what are your KPIs? So like KPIs, key performance indicators. That should be like a standard thing in strength conditioning. So the what makes baseball challenging is that like I'm not an offensive lineman who just has to push a 300-pound dude, right? So a good KPI for an offensive lineman might be how much
They
squatting
weigh.
500 pounds, like bench pressing 365. Like I'm essentially gonna have to bench press this dude in front of me. But like baseball is a little over 5 ounces, right? And so like, and then since people start getting confused, basically, they're like, okay, well, I see positive stuff going on from getting stronger, obviously, but at the same time, I'm going through this crazy shape changes in the throw, and ultimately, I'm throwing something that weighs 5 ounces. So do I have to bench press 300 pounds? Well, maybe not. You don't know unless you have something to test and retest against. So um, you're not going to get a lot of good KPIs in gym activities that correlate very well with baseball performance. Um, I have one of my favorite stories is like I have a kid who was drafted in the first round who, until like last year or the year before, someone broke it. He had the highest recorded fastball in college baseball. So it was like 101 or something like that. He gets drafted, goes to his first uh, like meeting with the team, and it's like the first strength and conditioning meeting thing, and they're like, well, we see a correlation between vertical jump and the guys that throw the hardest. Like, this guy can't jump for shit. He can't. His vertical jump, especially at the time, is like 19 inches maybe. He throws 100 miles an hour, and so like throw that out. Like I know, like obviously there's outliers. You can look at it like more big picture, but like I can speak to that. Like I don't see. I've gone through so many like try to come up with a performance assessment for baseball. Like, we're going to throw med balls for velocity. The guys that can throw the med ball the hardest. Let's see if they throw baseballs the hardest. Nope. The guys that jump the highest. Let's see if they throw the baseball the hardest. Nope. The guys that lift the most weight. Let's see if they throw the baseball the hardest. Nope. The guys that throw the hardest throw the hardest. Um,
Okay.
That's like bottom line. And so that's got to be a KPI. Like you're gonna have to use something in the sport in this case as a KPI. Okay. Um,
So is it
so
like,
so that's
okay, is it more of like, all right, let's do a 3-month deadlift block and then see if your velocity goes up?
yeah,
And
it's that easy if you actually like if you pay attention to it. Yeah. So it's like yeah, the only thing that stands in the way there is guys might not be trying to throw their hardest all the time. So like you might not get a great representation of that. But also another reason to like maybe not shut down for a super long time and like touch some velocities sometimes. But it's like, okay, yeah, okay, let's run a deadlift block. Let's try to get your deadlift up over these next 3 months. All right, fastball velocity went up 2 miles an hour. Sweet. Don't fix what's not broken. Do it again. Okay, it's another 3 month deadlift block. Deadlift goes up another 50 pounds. Velocity stays the same. Okay, that is whatever it was before. Let's say it was 400 pounds. Now you made it 450. 400 pounds was strong enough at this point in time. Okay, I'm not saying it's strong enough forever, but like at this point in time, 400 pounds is strong enough. Didn't do anything for your throwing velocity going to 450. So we gotta say, okay, well, we gotta look at something else. Like maybe that's where that we use force plates now that they're more accessible and we have some. So it's like, okay, like I want to look at your force curve a little bit. Not necessarily looking at how high you're jumping, but the that's where the force plate can be more useful than just like a vert mat or something like that. Not saying the vert mat couldn't be useful. Like vertical jump is a solid test of power for anybody. So if that's all you have, then maybe that is what you say. So okay, well, like your deadlift's 400, raised to 450, didn't affect your velocity. Your vertical jump's 24. Let's see if we can get that up. Okay, we get that to 26. It goes up another mile an hour. Cool. Do it again. It didn't go up. Okay, maybe now we revisit the strength side of thing, or maybe we need even more velocity. You know what I mean? Like again, we're talking about a completely velocity dependent sport. So maybe we need something even faster. Eventually you get to the point where it's like, okay, maybe the gym doesn't have as much to offer you at this moment as it did before. Like maybe you need to think about throwing. Like maybe you need to throw more. Maybe you need to throw harder more. Maybe you need to like make throws on there's a lot of different camps on that, but I guess what I'm essentially saying is like maybe you need to be as specific as possible. And a lot of times you do at a certain point when we're talking about throwing a baseball. In which case now you have to manage what they're doing in the gym in the sense of like, okay, well, if my throwing is going up this much, I can't necessarily have my cake and eat it too. I got to bring down my weight room activities a little bit to manage the recovery of all this. But that's really the only way to do it. That's the only way that you're truly going to know what's going on. So, like, if you're not measuring stuff, then you're just throwing darts at the wall, like blindfolded, just being like, oh, let's just get stronger and stronger. And, like, the other side to that coin is that nothing in life is good or bad. Everything has trade offs. Like staying up late to watch 2 more episodes of your favorite show is good at the time. But the trade off is your ball's tired the next morning and you suck at work. Okay, like, is that a trade off you're willing to make? Yes? Okay. Okay, well, you want to deadlift more? Like, I can attest to this. Like, I've deadlifted a lot of weight and I played baseball. I can't throw a baseball as hard as I could when I deadlifted a lot less. If it was just strength, I would throw 100 miles an hour because I'm stronger than all the baseball players that I train. So it's not that simple because there's a trade off. Like, do you want to rotate to be a good deadlifter? No. Do you want to rotate to squat 600 pounds? No. If you rotate, nothing good's going to happen during that 600-pound squat. You're training yourself to be a non-rotated. Like, so there's a trade off. It's like, and that's where you have to have other KPIs too. Like you should have movement based KPIs as well. So the order of operations for me, if a guy's starting his off season, is like, okay, I got 5 months. Let's say he's not injured, pain free. So I'm gonna do some movement tests. All right, he's not injured, he's pain free. So the numbers that I'm getting back don't mean that a whole lot to me because like I'm not gonna go off textbook averages and just say like, okay, well the textbook says that a hip should have 100 degrees total range of motion, 60 ER, 40 IR. It's like, yeah, that's an average. And like Louis Simmons said, like average people get average results. So like, if you want to be average, then get your hip range of motion to 60, 40, or 100 degrees of total hip range of motion. But no dude I've ever seen that comes in and throws a baseball at 95 miles an hour or more has anything close to what I would call textbook average ranges of motion, even if they're perfectly healthy, because they're not average. And what they're doing on the mound is not average. Therefore, it has a trade-off. It is going to take a toll on them. So what I want to do is say, okay, I really need to assess. I need to look at it through a different lens. Like instead of looking at it, like so many people go into the assessment and they just start poking holes and stuff like, oh, this is bad. That foot's bad. That's bad. It's like, this is a professional baseball player standing in front of you. He's the top 1% of what he does.
It's like a $10 million arm.
Instead of looking at it and saying, this is bad, say, how is this helping him? Like,
Yeah.
right? Like, how is this weird foot helping him put more force into the ground? How are these, you know, stiff ass hips helping him generate more velocity? So maybe I do want to give him a little bit back because I got to go back again. I got to go back to principles and like, what do I know? Okay, well, I know that um, if I'm losing a lot of relative motion, which is what I'm doing my best to test for, then I have positions that are like twisted. So every joint in your body works on a rotation. There's no hinges in your body. Bones don't touch. Um, and connective tissue is generally where we're going to see most of the injuries. Okay, so we're looking, like a UCL, or even if you tear a rotator cuff, like it's going to be up kind of at the tendinous insertion of that, right? So, um, well, how do tendons stay healthy? They stay healthy by getting nutrition to them. How do they get their nutrition? From water or fluid in the body. Okay, so then how does fluid interact with connective tissue? Well, it's like a towel with water. So it's not like a muscle where the fluid's inside the muscle and like it can't necessarily, it doesn't, it changes its shape, but not necessarily its volume. The water, when the connective tissue stiffens up and twists, it's like wringing out a wet towel. So the water gets pushed away from the connective tissue. And then as it takes on more of its, yielding representation again, the water is able to seep back in. It's a poroelastic tissue, so it acts like silly putty if you've ever played with silly putty. So it's like you just take silly putty, you roll it in a ball, you throw it against the ground, it bounces. It's stiff. You slowly press into it while it's on a table and it deforms. That's how connective tissue kind of works. So its behavior is very dependent on the components of force and how that's being applied to it. So if I got a lot of concentric muscle activity in an area, then that means I got connective tissue that's kind of getting squeezed 24/7. Which means I got less fluid that's able to get into that connective tissue. So over time, we're getting a stiffer, more plastic representation of that connective tissue. Now I go ask it to yield in a high velocity situation. Snap. I get a tear or something like that to happen. Um, so, I gotta look at like, okay, this is how you present. You're not hurt right now. With the adaptations that you're kind of showing me, like where these things are moving towards, if they keep going in that direction, what are the possibilities? Right. And so it's a management process from there, right? It's like, I don't want to take you all the way back. If I take you all the way back, you might suck. If I take you all the way back, you might not be, you might get hurt in another way, right? Like, so I don't want to take you all the way back. I just want to give you a little bit back, especially in the off season. I want you to be able to recover some of this behavior in these tissues. And so that's the first thing I want to get back. And now that becomes my KPI. It's like, okay, like I'm cool with this. Like we got a little bit back. This is where our ranges of motion are. Okay. And now we're accepting that, okay, like you want to throw harder. Okay. So we got to be a little more aggressive in the weight room. I understand that that's going to come with a possible trade-off of losing relative motion. But I have to have some proxy to go back and compare it against to know, like, am I doing too much? Right? Like, is the trade-off going to not be worth it? Am I in the end? Like, am I going to take away your ability to acquire some of these shapes? Now you can't get into these shapes. Now you can't use your superpowers anymore, as Bill would say. Like, so um, that it's like it's not a perfect science necessarily, but it's a
No.
really getting to know the athlete and like trying to manage them.
I want to make a point here too, based off what you said for people, especially any level of baseball really, but you have a very well adapted pitcher that's pretty high level, or batting or anything too, and you get injured. I would be very careful. And I've seen this happen a lot of people go out and it's like, oh, I feel stiff, I feel tight. Let me go get a massage. And they go get this aggressive massage, and like all of a sudden they have all this new mobility, And then it's like, yeah, my shoulder feels great, but I can't throw, or my target is off, or, my aim is way off. It happens with golfers all the time too. It's like, I had someone the other day, actually, it's a pretty high level golfer, and like he's got a super stiff T spine and it was in pain. It needed to be manipulated. So we did, but he didn't tell me he was golfing that day. And he's like, I felt so much better, but he's like, I could not hit the ball to save my life. And it's like, well, you're in this whole new world of, you have new mobility that you haven't trained with, that you need to learn. And it's like, especially with pitchers and things, it's so specific. There's so much adaptation that occurs. We want to make sure we're not just, we need to really respect why we have all of that, and make sure we're making those small changes at a time and finding what's good enough, not just trying to maximally have someone pulverize the, posterior aspect of my shoulder because it feels tight.
Right. Yeah. Like to use your example, like if we want to use golf or baseball, let's say it's the same dude, right? And he's got the T spine stiffness, but let's say it's not hurting him yet. Like let's say you caught him last year. Okay.
Yeah.
Likely the stiffness would still be there, right? It just wasn't hurting him yet, let's say.
Yeah.
And he plays, a tournament every weekend. So and he's really good. So that if you look at it through the lens, it's like, okay, what's the T spine stiffness doing for him? Like what how is it advantageous? Then you would say, okay, like he's not hurt, feels fine, T spine stiffness is good. Or maybe it wasn't quite as stiff as it was when you saw him. That my
Leave it alone.
approach to that. Yeah, well leave it alone, or like, okay, you play every Saturday and Sunday. So when you're finished on Sunday and you come see me on Monday, I'm gonna give you back some motion in your T spine. So like the kind of training, the kind of stuff we're gonna do is gonna be more geared towards giving you back some motion in your T spine, because that's gonna help your recovery, right? Like we're gonna get more stuff, more expansion there, more stuff being able to move in and out of that area. Um, but over the course of the week, ideally what I want to do is return you right back to where I found you on Saturday before you played your first hole. And then you just go over that. You just repeat that process over and over and over again. It's like what you're really doing is like, okay, this was a positive adaptation he made to hit golf balls really far and really well. And left unattended, that because he didn't see you, that adaptation just kept going in that direction. Now it hurts. But like if you kind of, so that's where I was saying, like if I catch a guy and he's healthy, I'm not gonna just like try to re-engineer the whole thing. It's like I'm
Yeah.
just gonna manage it. Like I'm just basically want to teach you strategies to keep you right where you're at. But I do want to restore some, and then maybe we'll take more force stuff, more velocity stuff midweek, like Wednesday, Thursday, and like let you stiffen up a little bit more again. Then you go out, you play golf, you're great, you win your tournament, you come back, we just do the process again, because now the adaptation just stays there. It doesn't progress to the point of being a maladaptation. It's a positive adaptation to the demands of your sport. Um, and so that's kind of the way I look at it. I get a thrower that's injured. It's like, okay, well, I get a thrower that's injured. Like, first of all, how good were you before you got injured? Like, did you suck? Okay, like maybe we re-engineer some more stuff. Were you really good? And now you're just hurt. Okay, so let's get you back, but let's not bring you too far back,
Mm.
because then we might take away your gifts, so to
Yeah.
speak. So
That's an interesting concept too, especially with baseball, of adaptations versus maladaptations, because we should expect to see, like you said, the shoulder joint of a pitcher should not look like any other normal person.
no,
Um,
no,
it should
you
be
should see it.
completely. You should have extra external rotation and probably limited internal rotation. So, um, yeah, there are certain other adaptations that people should know about that they shouldn't maybe mess with when, like, say they go to a physical therapist, like, oh, this kid's all out of whack, this and that, we need to restore this or that. And it's like, no, that's baseball. We need that.
Yeah, just like, well, that's where you need to understand this sequence of things a little bit. Like this stuff generally happens in order, kind of, so to speak. Like it's gonna it's gonna start more proximally and make its way out more distally in general, I would say. So, um, so like the positive adaptation to throwing would be like, yeah, so every humerus, again, you go look up a picture of the humerus bone. If you look at how it contours, it comes stock when you buy it off the lot with like an ER to IR twist in it already. Okay. And all the muscles they attach on that twist. So like again, they're not just sitting on there in like nice straight lines. Like it's all rotations and twists. And so you start throwing and literally like people don't appreciate that bones move. Okay. Like yes, they are
Oh,
stiffer than everything else, but bones are connective tissue. And they're just a very stiff connective tissue. But they move. If they didn't move, then let's go back to the bow-legged kid. Like, how the hell did that happen? Right? Like, he wasn't always like that. He wasn't bow-legged from day one, right? Like,
it happened over time. Yeah.
that's bones bending, right? So your humerus the muscle, because of the activity, will exaggerate that twist. You'll have more ER twisting at the top, and then what you'll get is relatively more IR at the bottom. So again, think of it like a towel. Like if I hold the bottom of a towel and I start twisting the top, like I can twist it for a little while without my bottom hand moving at all. So what I'm creating is more ER at the top and relatively more IR at the bottom. But if you keep twisting that towel, it's to the point where there's no like you keep twisting it, you're gonna get to the point where every little twist you make at the top starts to yank the bottom hand with it. Okay. And like that concept in general, that's gonna lead towards like the positive adaptation becoming a maladaptation. So now what's gonna happen is like the only way that you can rotate the arm isn't by a relative twist, it's by orienting the whole thing out into external rotation.
Mhm.
Well, eventually now that's gonna impact the next thing. Now you're gonna have so next you've got a radius and an ulna. Okay, well now they're not staying in relatively different position than the humerus. Now they're getting yanked along too. So now like you go into throw and like everything's going into ER, right? Which at first is fine because everything does go into ER as you lay that arm back. But it's gotta go the other way too, right? So like then what people have to appreciate is that like I know it's hard to think about, but like technically you can see it nowadays if you look because we have all these like cool slow motion cameras for throwing where you can literally see the ball leaving the hand and the fingers are getting bent back as the ball presses against the fingers. That's the same as like your toes getting pressed against the ground as you move off the ground. So there's that internal rotation, that force. You're applying a force to the baseball. Okay? Ideally, we would have had this segmental wave, just like when we talked about walking, how it kind of went from like ER to IR, but everything before the wrist is just kind of stuck in external rotation, right? So instead, what we're getting, because we had to orient ourselves into external rotation, now we have to orient ourselves into internal rotation. So now we see a scap kind of just riding up and over, and like almost like a shrug kind of, where you see a head kind of whipped to the side. And then what you'll see like a really big twist and bend at the wrist into internal rotation because it's like, okay, I'm not getting much internal rotation anywhere else. So I'm just gonna manipulate the hell out of this baseball by twisting my wrist into pronating really hard to obviously throw the ball where I need it to go. And now you can think about how that could eventually become a UCL issue because the humerus is turned into external rotation. The radius is turned into external rotation. If you did that with your fingers against a wall because it's immovable, right? You would feel that right in your medial elbow because the medial gap of the elbow is just wide open still. It never really closed because you're putting all the force on the baseball. Like that's why you see, could be a reason why you see like a lot of kids, they start to learn like new pitches like sliders and cutters, and they don't really understand how they're supposed to throw that. So the way they think they're supposed to throw it is like really like cutting the crap out of the ball and externally rotating around it, right? So they're effectively just sort of leaving everything in an external rotation, but they're still applying a force to the baseball. Like, it's still
Mm-hmm.
got to get that push at the end. Um, and so then, and then we go back to the connective tissue thing, right? So to get there, the arm was all twisted anyways and kind of just stuck there in that twist. So now you got a UCL that's not getting its not getting its recovery, its nutrition. So like over time, that thing's becoming more of a plastic representation, and you're asking it to yield more than ever because you're not closing the medial gap of the elbow. So that's a lot of like deceleration having to happen at the medial elbow, but it's not prepared for that much force absorption with the kind of the behavior that it's taken on, which is more plastic instead of being able to deform. Snap.
Mm.
So it's like, did you go out and snap your UCL on that one pitch?
No.
That was like coming, And so like that, we look at that a lot, like in UCL and Tommy John rehab. Like obviously I don't handle it acutely, like post surgically, but most of the time when I get them, like I'll start working with kids at 3-4 weeks out, and at first I can't really do anything with the arm still. But what I can say is like, if I look at that iteratively, that means you had a huge orientation to external rotation up top. You got it. You got it everywhere on that side. So I'm gonna start addressing the hip, right? Like you didn't have a hip that could internally rotate, so you couldn't close all that big separation, that big movement that you had to go into the throw. Like that couldn't close. So everything was just held open. It's like that doesn't get addressed enough, in my opinion, in the Tommy John rehab, where it's like, well, we got to look at the whole representation here. And then when I can get my hands on the arm, that twist is still there usually, right? Like that, they're not addressing that twist. They're just getting you back to full elbow flexion, making sure that it's ready to go. But like, do I still have a humerus that's oriented out into ER? Do I still have a big twist there? Possibly, yeah. So I got to make sure that I undo that a little bit. But again, I don't want to take it back too far because it's like, don't want to take you back to a normal arm, like you said. Like, I do want some orientation into external rotation. I just don't want it to have made its way all the way out to the elbow and to the wrist and to the hand.
Yeah. And there's a lot we could go on and on with there, but those basically just summarizing all those total body mechanics from the ankle all the way up to the fingers is important for what's happening at the elbow, at the shoulder, at the neck, the thorax, whatever. Another thing I was thinking of with baseball too that I was curious about. Baseball is such an interesting sport where, especially like if you're an outfielder, right? You could be standing there for, I don't know, 15 minutes, sometimes a half hour, and not really be asked to do much. And then that ball gets hit to you, and you have to sprint as fast as you can, and then whip a ball as hard as you can. And you're pretty much cold at that point, especially depending on the time of season. So, are there certain things, because like, okay, we want to stay warm in a sense of like, we want to, like, I know with me lifting, like, if I don't hit something for like more than 5 minutes, I feel like trash. Like I need to stay neurologically innervated in a sense.
Mm-hmm.
But with baseball, are there aspects of training you do to focus on that aspect of the sport? Because like I know we still see like a significant amount of hamstring, Achilles strains, tears, which that might be a big part of it. But are there things we can do to prevent those things from happening with certain people or positions?
Yeah, I think so. If we're looking at those injuries just strictly through the lens of like exposures, so let's remove the fact that maybe the strategy for running is off or something like that, and that predisposes you to a hamstring injury, right? Everything's good. Um, what baseball I don't think, maybe it's a little bit more now, but like doesn't utilize that other field sports do would be something like GPS, right? So like um, most, my understanding, most let's say NFL teams, let's say you're a wide receiver, and your max, your top end sprint speed is this. I'll take one of my like I don't have a lot of other base sports other than baseball, but I do have a few. One like girl who plays lacrosse, she's really fast. Um, so her top sprint speed in a lacrosse game is like just under 30 miles an hour. I think it's like 28.8 or something like that she hit. Maybe not mile. It might have been not miles. I forget.
Kilometers.
Kilometers, yeah, kilometers per hour. I'm just thinking of this because yeah, she like had some showcase thing and they gave her back this report and it kind of showed like, okay, this was your max sprint speed. This is how it compares to the U.S. like women's lacrosse team, and she was like damn close to the best on that team. And like to her testament, she's like, oh man, she goes home and looks up like top speeds of like track sprinters, and she's like, I'm not even close to like the fastest person and like the fastest girls. And I'm like, listen, you you were like point 0.7 off of the fastest lacrosse player. Like, don't compare yourself to a track athlete. So, but should get to college, they'll probably use GPS. So that at the end of the game, it'll be like, okay, you hit your top speed like 2 times during this game. Like, you made this many full effort sprints during the game. And so you then, as a strength coach, you would calculate and say, okay, like we got enough exposures to your top speed during this game that we don't really need to hit top speeds in practice too often. Excuse me, leading up to the next game. But you won't see that in baseball as much because, like you said, a guy you go a whole baseball game and not sprint once, technically, right? Like it could just be a bad day. You didn't make any contact, no ball was hit to you. Um, so as a strength coach, that might be the place where it's like end of the game or the next day if you have a day off or even pregame. It's not going to kill them if you do the right amount of volume. It's like, hey, we need to hit some max effort sprints here because like if you don't get the like if we look at qualities like velocity is going to if you don't hit velocity if you don't hit a top near a top velocity every 5 days, it starts to deteriorate. It's different than max strength or aerobic. It's like you use it or you lose it. So I think that predisposes guys to hamstrings and Achilles type stuff. Is like you're just going too long without exposing yourself, especially if like you're a fast outfielder and you can sprint really fast. Well, if you're not monitoring that and you just didn't sprint really fast for 4 days and then a ball was hit to you and you obviously react and are going to hit it the gas 100%, pop a hamstring. Or like I don't know, you were 0 for your last 18 and now you just hit a double in the gap and you're going full speed to second base and you pop a hamstring rounding first. It's like all you probably had to do was just hit a couple top end sprints pregame, like leading up to that because you didn't hit any during the game. Now, that being said, if you hit 2 doubles, had 4 balls hit to you, and you hit a bunch of max sprints during the game, like cool, call it a day, go home, like do your normal warm up the next day, go back out there, like that's. I don't have any evidence of that because, in the sense of just like I don't work with a team necessarily, so I'm not monitoring that. But
Yeah.
that is like the advice I give my guys. It's like, hey, you don't have GPS, but one thing you do have in a baseball game is you keep a scorebook, right? So like if you did nothing, or like, or if I'm talking to another strength coach and they want advice, it's like, okay, yeah, you don't have GPS, but like you have a scorebook. It showed you like what this guy pretty much did as far as base running, um, or what balls were hit to him, or how many balls were hit to him during the game. Um,
Yeah.
it's like
I was just
so
thinking.
that's where I would go with that kind of.
Yeah, I was just wondering. Yeah, with like this all the stop start. it could be there 20 minutes, half hour, sometimes hours before you really like max sprint again, besides like jogging out of the dugout. If there's any extra emphasis on like eccentrics, things like that to keep, the tendons resilient and everything from tearing, that you're doing in training.
I guess not looking at it from that lens necessarily, but like, yes, in the sense of, so I'll look at eccentric, like I'll go back to connective tissue because like muscles are not what is transferring energy through the body. Connective tissue is what's transferring energy through the body. So it's like it's the yielding versus overcoming of the connective tissue, which is influenced obviously by the muscle activity. But like that's where we can look at like the guy in front of us. We can look at stuff like his force plate data and see like, okay, what does this curve look like from in the braking phase versus the propulsive phase? Like, because sometimes it's very obvious. Like, you're great at producing energy, you suck at storing energy, man. Like, I don't need to give you more force production. I need to give you the ability to store some more energy. So that that might not look like eccentrics in the traditional sense, um, because we have to understand how connective tissue behaves. In that, like, if I take out 80% of my squat 1 rep max and I decide I'm going to do a 5 second long eccentric, that's gonna give me some yielding of the connective tissue, but not very much, because as soon as I unrack 80%, I got concentric activity everywhere to hold up that weight against me collapsing, which means I got connective tissue that's tuned into an overcoming representation. So like when a powerlifter's squatting 600 pounds, he's changing shape. He's changing joint positions. He's not doing that via changes in muscle orientation very much. All the muscle is pretty much concentrically oriented. Some is just a little less concentrically, like motor units are dropping off to help him, um, be able to go in a certain direction. But the connective tissue behavior is overcoming pretty much the entire time. So like the kind of the question I always pose to like our interns and stuff off the bat is like, what would get you more yielding connective tissue? Squatting, let's say 80-90% for 3 reps, or doing a depth drop off a box with a 2 second stick. Like, if you're familiar with that, like just step off the box, land, and stick it for 2 seconds. And a lot of times they'll say the squat because they see like the bigger changes in range of motion. So they'll say like, I'm getting more yielding of the connective tissue in the squat. No, you're getting more yielding of the connective tissue in the depth drop because
Quicker.
the rate of loading is instantaneous in the squat. As soon as you unracked it from the J hooks, you were loaded with whatever the load was for that squat, 90%. Everything is about pushing back up. You're just dropping off enough motor units to make sure you can go down, but like you don't want to drop off too many of them, and you don't want the connective tissue to go like too yielding at all. But in the depth drop, yes, that's rate of loading is still very fast, but you're weightless, you're free falling for a moment, and then you are also anticipating the landing. So like right before you land, nervous system kind of kicks on, you get concentric muscle activity, but the connective tissue is a tick behind. And so what's going to happen is you get a stiff representation of the muscle, pulls on the connective tissue, which then does stiffen up, but especially if you're sticking it and not trying to change the direction, you're going to get this dissipation of energy, and you're going to get the deformation of connective tissue, not the change in muscle length, because you're holding the position. Like that energy had to go somewhere. It's going to disperse out into the connective tissue. So we might do more work on that end of things with guys that might be predisposed to those kind of issues. But
That makes
the big
sense.
thing the really big thing I look at with him, if I got a guy with like recurring hamstring issues, is that you probably got a guy who's trying to put force into the ground using external rotation strategies and doesn't have internal rotation strategies. So you pull a hamstring.
All right. Interesting stuff, man. I think we can kind of wrap up here. We went through a lot. That's a lot of information for people to take in, myself included. Anything else you wanted to add, Greg?
No, hope that was helpful. I warned you before that I just go down like rabbit holes after rabbit holes, but like passionate about just trying to get as close to like what's really happening as possible, and just that's what keeps me going and keeps me up at night too. So
Do you? Yeah, I was gonna say it sounds like baseball could just be the sport that's like, what the fuck? I don't know what way is up with any of my athletes. There's so many different variables you have as a coach to manage, as a strength coach too, and you're not on the field with them per se. But it's like it's got to keep you up at night. Because even with my, with weightlifting, it's a pretty easy objective standard of, there's external factors to it too. But it's like, well, okay, this block, do we put more weight on our max or no? And then we can change a couple variables. Baseball has so much more to it, and it's like,
yeah,
especially when you're dealing with college kids.
well, yeah, then there's a lot of lifestyle variables, and things to consider too. But it's true. It's like, it's like that's why when you're looking at like performance stuff, track and field's always such a great place to go to. Like they always have such good information because it's like just like weightlifting, it's just so cut and dry, right? Like, okay, we did this block and I ran faster. Like this makes you run faster. Like if I want to get a kid to run faster, I'm gonna go look at track and field. Like that information can be pretty solid. You look at baseball, it's like, well, I think we had the great off season. Like we did everything, like performance wise, physically, everything's great, and it's like such a skill dependent game at the same time that you could still go out and suck. Like you could just have a bad year, and then that can be frustrating when you're a strength coach, depending on how you communicate with your athletes and how you help them understand it. Because like I run into it plenty of times where it's like I had a bad year, I better change up everything that I'm doing, and it's like, well, like was it the training that gave you a bad year, or is it the fact that you can't hit, or like the fact that you can't throw strikes? I'm not saying that there's not training things that maybe could help you with that, but at the same time, can't say for sure. Like such a skill dependent game. That's why you also have baseball players that never sniffed a weight room, drink 6 beers every night, and win a Cy Young. So like, it's
Yeah.
it's interesting. It's interesting.
Yeah.
But
Yeah. I was gonna say, other kids that you see in the weight room that just are like not good in the weight room that are great baseball players.
yeah. I mean, well, I guess it depends on how you define good in the weight room. Um, there. Let's put it this way: there's certain body types that blend themselves to throwing baseball really hard that don't need a lot of what you traditionally would say is like good in the weight room. You know what I mean? Like they don't need to move a ton of weight. Like they just need to move some some weight, or like maybe they don't even need to move a lot of weight. They need to work like it's so dependent on impulses, right? Like the force with the time consideration is really important in a sport like baseball, right? It's not important. Well, it's more important in weightlifting. It's not important in powerlifting, let's say, for example. Like, it doesn't matter how long it takes you to do that lift. So you might want to think about that when you're trying to turn a baseball player into a powerlifter. That might be a consideration that you need to make. And like, also like, you look at a lot of guys that throw hard. They're like 6'7", super skinny body types. They're not going to be able to handle weight room activities like a dude like me, who's just like a chode of a human and just can like that's easy to. I was built to do weight room stuff, right? And that's how I end up as a catcher in the game of baseball because
Same.
because I just wasn't tall enough to play first base, and when I didn't catch, played third base. So it's like,
Same.
yeah, but that goes to come full circle. That goes back to the whole body type thing. It's like,
Yep.
your 6'7" pitcher is not going to be anywhere else on that field except right on that mound. Like, that's what
Yep.
he does.
Yep.
And so
Five.
you got to consider that before you just say, hey, this is the pitcher program.
Yeah.
You got one pitcher that's 5'9", you got one pitcher that's 6'7", you got one pitcher that needs to go out and throw 100 pitches, you got another guy that throws 10 pitches at the end of the game as hard as he can. You're going to train all those guys the same? I think that's a mistake.
Yeah. Awesome. That's a good note to leave it off on. So, Greg, where can people find you if they want to get a hold of you?
Like for training stuff, I'll just run it all through our gym, mostly in pretty much only Instagram. It's just The Strength House or at The Strength House. You'll kind of try to put up mostly just sort of like clips of our guys training, sometimes some more informative stuff. I have a personal Instagram. It is Greg_Robbins_TSH, but that's mostly pictures of my daughters. So I don't know how much you'll take home from that. But if you wanted to like personally reach out to me, you could do it through my, I check both Instagrams, but you could do it through my personal Instagram. That's fine. We have a website, thestrengthhouse.com. And yeah, I'd say that's about it. I'm not super active on the social media. I'm working on that. Been working on that for a long time. I'm
Same.
gonna get around to it.
Yeah.
But maybe I'll get more active on there soon. Who knows?
All right, man. Well, great having you. This is a nice nerdy discussion, and hope we can do it again at some point soon.
Yeah, man, I appreciate it. Thanks for having me.
Thank you.
84% of you that listen to this podcast frequently do not hit the follow button. If you've enjoyed any of these episodes, could you do us a favor and hit the follow button, leave a rating, and maybe leave us a review? It helps this channel more than you know, and the bigger the channel gets, the bigger the guests get. If you'd like to know more about training in person or online with Bret's Gym, Architect Fitness, please follow us on social at ARKITECT Fitness on Instagram, or visit ARKITECTfitness.com. Or if you want to rehab with barbell therapy online or in person, check out @barbell.therapy or visit barbelltherapyandperformance.com. Thank you for taking the time to listen.